I'm Dr. Alex, a registered medical doctor. I'm here to answer your questions from social media. Question number one is from Edifrox88, who asks, is it true King Baldwin had syphilis? That's why he covered his face. For some of you who don't know who King Baldwin is, he is the king who was the king of Jerusalem from 1174 to 1185, and he has been making rounds on TikTok as a meme, acting with a mask. So King Baldwin had a disease called leprosy, which disfigured his face, and to hide his disfigured face, he put on a mask, so he did not have the syphilis. But a famous person who had syphilis would be the American gangster from the 1920s and 1930s by the names of Al Capone. Al Capone developed syphilis, and his syphilis advanced, and he got what we call neurosyphilis. Neurosyphilis makes someone get psychiatric issues. And by the time he received treatment, which was in the 1940s, he was one of the first Americans to receive penicillin after it was being mass-produced in the 1940s. However, his disease was very advanced that the penicillin did not help him. So by the time he passed away, his reasoning and mental capacity was like that of a 12-year-old after his psychiatrist assessed him. So yes, and it's very true, syphilis can attack your brain and then cause issues with your brain. Cheyenne Brooks Tulum asks, can gonorrhea cause death? The answer is yes. However, it is very rare for gonorrhea to cause death. When gonorrhea is left untreated, it becomes disseminated into the body, attacking other parts of the body, such as the tendons, the skin, and the joints. However, it can also attack the brain, causing meningitis, and also the heart, causing a condition known as endocarditis. However, this is very rare. This form of gonorrhea happens in around 3% of the cases of untreated gonorrhea, particularly among women. The reason is that when women are infected with gonorrhea, they rarely show symptoms compared to the men. For the men, it takes around 3 days for the symptoms to occur, which are characterized by a sharp razor-like pain when they are passing urine, which kind of prompts them to go and seek health services. However, for the women, there are no serious signs and symptoms after they have acquired gonorrhea. So their gonorrhea remains untreated, which can lead to disseminated gonorrhea, or which can cause death. However, this is a very, very rare occurrence, but can happen. Michael Grain 50 asks, which diseases with no cure are spread via kissing? I can think of 2 diseases. One is EBZ. EBZ stands for Epstein-Barr virus, which causes a disease known as mononucleosis. Most of the people in the world have been affected by this virus. However, because of their body's strong immune system, it clears the virus in most of the cases. We don't have any known medication which can clear this virus from the body. And this virus has also been implicated as one of the viruses responsible for formation of some types of cancers, such as which gives the lymphoma, which is a form of cancer, and other cancers. There is no known medication which can clear it, because within through kissing, transmitted via saliva. Then there are diseases, the herpes simplex 1 virus, which is also transmitted via kissing, transmitted via saliva. There's no known medication which can cure the herpes simplex virus. However, the body tries to fight it, and you have medication which can try to turn it down. However, the virus hides within the mouth, and then later in the future, it raises up again. These diseases, the assumption is that there are no open wounds within the mouth, so this gets transmitted via saliva. Someone 777 asks, what medicines can make a condom less effective? Yes, there are some medications which can make a condom less effective, especially if the condom is made of rubber. The medications are miconazole. Miconazole is a drug which is applied as a accessory when a woman is having